Good afternoon. Today we will be presenting barriers to mental health improvements prevailing even today. So, does anyone know the prevalence of mental health issues in society?
No. That's why we're here to tell you.
So 1 in 5 people have a mental health condition, yet 70% of those affected do not even receive treatment.
So the research question that we were looking up was what obstacles have impeded mental health improvements? There are 3 topics that we want to talk about. First being societal mistreatment and the stigma behind the mentally ill. Second, we want to talk about economic deficiencies and its effects. And finally, we're going to go to governmental policies, and this will all be covered in our solution.
All right, the stigma and mistreatment of the mentally ill. Okay, so the stigma and mistreatment of the mentally ill can generally be divided into 3 time periods, centered around the European scientific enlightenment, before, during, and after, essentially. So pre-enlightenment involved the belief that the mentally ill were being possessed by demons or punished by their gods for their sins. This generally led to being burned at the stake or, unfortunately, locked away from society in madhouses. However, during Enlightenment, about from the 1700s to the 1800s, the creation of private madhouses led to the moral treatment of the mentally ill and increased brain capacity for them, even allowed them to be cured, which was a major improvement for them as a whole. However, the view reverted back to what it was originally, and that they were being punished for their sins, which saw the end of the Enlightenment, essentially. But shifting over to the post-Enlightenment, the early 1900s involved controversial tests, such as lobotomies and electric shock therapy, being carried out on unwilling subjects, affirming the belief that no one wanted to go to a mental institution. So no one was enrolling in mental institutions because they believed they would be injured. And by the mid-1900s, the tactic of moral treatment and asylums in general were seen as inefficient and abandoned due to their costly value. And they were abandoned for prescription medications, leading up to the deinstitutionalization of thousands of mentally ill. As of the 21st century, the main societal stigma has caused a depression of job opportunities for the mentally ill, leading to a less productive workforce.
In fact, Dinesh Bergera, a professor of mental health at King's College, found that nearly 9 out of 10 people with mental illnesses face discrimination, which has caused a negative effect on their lives.
So stigma primarily affects certain groups of people. For example, when it comes to children, there's a stigma against the children actually seeking help. So according to an article by Huffington Post, parents have this fear that if their children are formally diagnosed for a disorder, then they'll be labeled and perceived as pariahs. And this mistreatment that is caused by the stigma leads to the parents discouraging their kids from seeking help when they need it. On the other hand, for adults, there's a stigma that leads to lack of job opportunities. So, according to a report by the Federation of Trade Unions, only 1 in 4 people suffering from a long-term mental illness are working and have lasted for more than 12 months in their workforce. The reason for this type of discrimination in the workplace is because people with mental illnesses are perceived as less capable than others simply due to their disorder.
As well, mental illnesses are also often disregarded unless they're severe, and when they're severe, they're associated as dangerous. So over 45% of participants in a study discussing mental health disorders claim to associate those who have depression or schizophrenia as dangerous and were unlikely to employ someone with a mental health care issue, with a mental issue. Macy will expand on this next.
Employment rates for those affected by mental health are dramatically lower than those for their counterparts, even when they have similar qualifications or backgrounds. And this leads us into our next topic, economic deficiencies. Only 32% of uninsured U.S. residents who have mental illnesses actually receive care beyond their insurance, and only 12% of them actually receive adequate care for their illnesses. Of these, a major component of this is children. So only 87% of children do not receive proper care for their illnesses, even when their parents try to seek it out. But because children are not in control of their own decision-making about whether they should receive treatment or not, they do not receive treatment. On a more global scale, countries both developed and developing often have issues regarding allocation for resources and funding to actually create these programs. So this is either because they are unable to pay or because they lack an existing infrastructure to actually develop them. In addition, unintentionally racist policies instituted by governments sometimes can affect the treatment rate for people who have mental illnesses because of institutional biases.
Here is a graph showing the mental health budget as a percent of overall health spending. As you can see, most countries spend less than 10% of their health budgets on mental health, revealing that it's very low.
The next topic that we're going to talk about is governmental policies. So, despite the amount of people with mental issues, many people do not receive the treatment they need. This is mainly due to lack of funding or because companies such as Medicare and Medicaid cannot cover the expenses. This is because every year, government funding for mental illnesses dropped 10%, resulting in a dwindling workforce in the mental care industry and a lack of patients able to receive treatment. The second thing I want to talk about is that so much focus and research is spent on those with only the most severe cases. According to the Mental Health Association of America, system failures leave people without the treatment they need because they're not considered a public critical issue, when in fact, untreated mental illnesses cost governments, taxpayers, and even businesses around $200 billion. This leads to many social and economical issues. The final point that I want to make is that government programs that are supposed to ensure and guarantee one's patient's integration back into society are often flawed. What I mean by this is that people are left without basic care or medication or access to resources even after their treatment is finished. An example of this would be medication. Many people do not have access to the medication they need to get assimilated back into society.
As well, a significant proportion of the population who are disadvantaged due to governmental policies are adolescents, as 43 states have a severe shortage of pediatric psychiatrists. Adolescents are thus unable to obtain quality care because governments do not provide enough facilities and because governments do not provide insurance. It was found that budget shortfalls have prompted 34 states to drop 500,000 children from Medicaid SHIP through tightened eligibility. This graph shows the unmet mental health needs of U.S. children, and as you can see, 87% of uninsured children do not receive mental health care.
All this leads into our team solution, which has 4 main objectives. The first of which is strengthening mental health leadership. So what this means is having more effective governance and regulation of the mentally ill to make sure that we are reaching them and making sure that all of their needs are met. Second, we need to provide better and more responsive care and services that are integrated within our communities to make sure that everybody is reached. Third, we need to promote awareness of mental illness and make sure that these conditions are being known about so that you may find them before they may be exacerbated by the time. Fourth, we need to strengthen information systems. We need to devote time and attention to making sure that we research these mental illnesses and make sure that young children are informed from an early age.
So one limitation to our proposed solution is that while the government may be focused on improving mental health policies, other aspects may be insufficiently managed or end up completely neglected. Second limitation is that it would be very costly to integrate all 4 parts of our solution. And finally, a comprehensive mental health plan may not lead to equal implementation among schools across the entire nation simply due to the fact that education is not necessarily taught in the same way at every school, and teachers may not be trained enough on the subject matter to increase awareness thoroughly.
So the implications of our proposed solution include that a stronger policy would create more beneficial care for all mentally ill patients, as it would provide more resources for their care. As well, it would provide people of all creeds with equal care, as it would create more centers across all over that would be able to treat mental illnesses. Finally, it would promote awareness for mental illness, as it would provide young people with education so that they would be able to recognize the symptoms early on and prevent future mental illnesses.
In summation, we face a misperception that healthcare is a luxury item on the health agenda. Dr. Margaret Chan, Director General of the World Health Organization. As you can see, our solution is the direct answer to this issue. Thank you.
And then these are our citations.
Okay, so let's start with Arushi and go this way, okay? So let's see. Arushi, so give one specific way that your thinking changed as a result of learning about, let's say, Macy's findings.
Okay, well, Macy talked about affordability, and I was honestly surprised by the degree to which this matters in our context, because it's not only focused on affordability of individual people who cannot afford mental health care, but without, you could even have eliminated stigma, which is also another major aspect that Jenna discussed. You could eliminate stigma, but if you can't afford the mental health care, then our solution is not going to go anywhere. As well as this connects with Victoria's perspective on governmental policies, because if the government cannot afford the funding for mental health care, it's a large scale issue. This affordability is a large scale issue and affects way more than I originally thought it would. Because I used to think, oh, like a family can't afford it, so, you know, or I used to think they were only settled on like third world countries, but I didn't realize that this is actually a major problem and how neglected it is.
Okay. So, Jenna, let's see. Wait, it was wait. Okay, I can remember which one was where. Okay. How did the group decide to include, let's say, your sister's perspective?
So she mainly talked about adolescence, and a large portion of those who have mental illness are actually adolescents, because at age 18 lots of like schizophrenia and bipolar disorder tend to set in. So we thought that that had to be included because that's such a large population of the mental community.
Okay, so in what way did you improve your ability to work with a group as a result of this project, Victoria?
One thing that our team definitely began struggling with at their very early stages was deadlines. For one, on our sheet that we made with our goals, we weren't very specific. Oftentimes, we'd have to push things back because we weren't prepared, or we didn't have, or because someone didn't do the work, or someone was absent. Not your fault. It's just there are so many different factors that can influence time management, and I think we really learned how to work around those and like spend extra time working on those steps to make them work.
Okay. So, Macy, what was the strongest counter argument to the solution or conclusion your team identified?
Well, like because our solution is so like all encompassing, like it addresses like 4 separate aspects. Like we think that it was probably the strongest argument that we could have come up with. And the only real counter argument would have to be like the cost of just putting such a system out there is just so broad that it would be really very expensive.
Okay. So, give me an example of a compelling argument from one of your peers' individual reports that you decided to not include in the presentation. Gigi.
So Macy talked a lot about how women and other races have problems receiving mental health care, and it was compelling. We just found that it was very specific and that we wouldn't have enough time to touch enough on it.
Okay, thank you for
I have a question.